I just wanted you guys to all know that. All right, ready for your next comic? Keep it going for Michael Robbins!
Hey, thanks you guys so much. I'm so glad you came out here to support this class. You know, doing comedy is hard. It's so exciting, it kind of distracts you. Like during the day I'm thinking about how could something be funny, you know, like a conversation. It's really distracting, it's hard to pay attention. Even at work, I'll be having a serious conversation with someone, and I'll just start to think about how that could be funny and blurt something out, which is terrible because I'm a therapist and these are my patients. Yeah. I mean, I wasn't even listening to people before this, but now I'm not even paying attention at all. Like I had this one woman, she was talking about whatever she was talking about, and I interrupted her. And I said, you know what would make that story funnier? She said, Dr. Robbins, I'm not really trying to be funny right now. I'm talking about my breakup. I was like, wow, I haven't been listening to her for like 2 or 3 months. But don't worry, I pulled it together, and I had just like a normal session. I started focusing again. I really had it going, and she said something like, yeah, my ex, I don't want to let him in again because it hurts too much. And I said, that's what she said! And yeah, she left me hanging and she started to cry. Yeah. But you know, this is where I'm getting most of my material now. I don't do a lot of other things but sit in an office and talk to people about their problems. So it's really affecting things. Like I'll get a call for an intake and I'll say like, okay, what's your issue? Okay, you're really depressed and you never leave your house? Sorry, that's not funny enough. But maybe I'll get a phone call and someone will be like, wait, your husband did what? And he was wearing, wait, what? And the kids were there? Come in on Tuesday. Thank you. Actually, to be honest, it's made a lot of things awkward. And here's why. This is like crazy, because I never did Instagram, I never did Facebook because I'm a therapist. But now I guess I don't care. Actually, I don't know. I do it, I don't know why. So people are finding out that I'm a stand-up comic while they're doing therapy with me, which is very awkward, especially given all this shit I just told you, right? So like a couple of days ago, I was doing an intake with this couple, and the guy was talking about his relationship with his wife. And I said, what's going on here is that you're suffering from some attachment issues, probably because when you were younger, you weren't treated well by your mom. And he just looked at his wife and said, this guy's not funny at all. And she said, I thought you were funny. It was really hard to get him to come. And he said, that's what she said. And gave him a high five. And I started to cry. I mean, I'm sure all of you are fucked up in various ways, right? Right? Yeah. How many people have anxiety of some kinds, of phobias? Yeah? How many people, raise your hand if you have a fear of flying. What? Just a couple people? Okay, great. Raise your hand if you have a fear of raising your hand in comedy shows. You're cured. Congratulations. That's great. Thanks. I work with all of the kinds of disorders. I work with OCD. I work with ADD. I work with LSD, which makes it hard to concentrate. Sometimes it might be part of the problem. My favorite one is OCD. Because at the end of the day, if I see some people with OCD, at the end of the day, my office is totally clean. And maybe my taxes are done even also, you never know. Okay, so I have done a lot of different kind of work, and I think I'll just tell you a little bit about it. I work with imposter syndrome quite a bit. Does anyone know what imposter syndrome is? Well, then how do I know you're not lying to me right now? Because that's what you would say. So I worked with this guy. It was really hard, but eventually he got rid of his imposter syndrome, and then he lost his job because he was an undercover cop. Today I had this intake with this guy, and he said, listen, I'm just anxious about driving on the highway, and I avoid bridges. And I live like just one house over from my mother. What's wrong with me? And I said, you're from Rhode Island. How many of you think you're kind of screwed up and should be in therapy? Raise your hand. How many of you think you're kind of screwed up and should be in therapy? Okay. That's good. You guys aren't the problem. All you other fuckers are the problem. Yeah. Yeah, and I spend like half my day helping people, like this nice woman saying, you're not screwed up, like this is for everybody, everybody's like this. And I spend the other half of my time trying to get you other fuckers to realize how fucked up you are. That's kind of what I do. At this point, you're probably not sure if I'm really a psychologist or not, because you're like, that is really fucked up. But I'm gonna prove it. I'm gonna show you a little bit of therapy right now, okay? So, this is gonna be a little difficult, and it's a safe space. Nothing leaves this room. Does anyone want to tell me some kind of problem that they might go to a therapist for, and I'll tell you what I would do in that situation. Is there anyone brave enough to do this? Anyone? Very good, you passed the test. That would have been really fucked up. Yes. Okay. What? Did anyone? No, still? Okay, great. You guys are the most healthy people I've seen. All right, one more thing I want to say is I'm not a psychiatrist, so don't come to me if you're looking for medication. But doing therapy, you need to learn a little bit about what medications work for which kind of people, you know? You can imagine that, because I just work with so many people with meds. So there's this one guy, for example, who's really difficult to be around, and his wife and him are having a lot of trouble. So about like 30 minutes before he comes in, I'll take like a half a milligram of Xanax, and I'll be totally fine. Thanks, everybody.